Hello class. Chapter 11, Admission, Discharge, Transfer, and Referrals, page 167, Lecture A. We're going to discuss various processes that will occur in your facility. One, I want you to know, this is just something to write in, if you hear a code pink called over the intercom at a facility, at a hospital, that means there's an infant abduction, code pink. So you need to know the admission process. Admission, of course, entering a healthcare facility for nursing care and medical or surgical treatment. It involves different disciplines. You do not have to know these for exam, but some authorization for physician for someone to be at that facility. Collection of billing information. Development of an initial nursing care plan. Initial medical orders for treatment. That's just FYI. On 168, there's something I have written in that you need to write in. If a client is missing from a room and returns the next morning, admission process must be repeated. Just know that for NCLEX. There's different types of admissions. Table 11.1, inpatient, outpatient, just FYI. Gero, this is FYI, but it's very important. Many older people are afraid to go into the hospital or long-term care because they're afraid that they will end up not ever returning home, that they'll have to live in a nursing home. So they may minimize their symptoms to protect their independent living status. Aging does correlate with increased incidence of acute disease and exacerbations of chronic conditions. And remember, this is FYI. Pets are often an integral social support system. People had pets at home. You will see that some people have pets in assisted living or long-term care. We can't just bring an animal in to visit. That has to go under some documentation and permits and all of that, but the residents, they can have animals living there if all of this documentation has been adhered to. Non-adherence to medication regimens, taking medicine accounts for more than 10% of older adult hospital admissions, just FYI. Medical authorization, this is FYI. Before admission, a physician, of course, has to determine if the client needs special care, lab test, or treatment. The doctor will have to order an admission to a hospital, for example. Most people are seen in primary care or the ER. The doctor is going to advise both the client and the nursing staff to proceed if he or she wants that client admitted, and this is FYI. The admitting department, they initiate the medical record with the data that we've obtained, prepare forms with the client's address, date of birth, place of employment, insurance carrier, policy numbers, medical record numbers. The part that you will highlight is on the right-hand column. You're going to highlight all of this. Generally, the admissions clerk prepares the ID bracelet for the client. It also has the date of birth on this, the date of birth, which contains the client's name and ID number, and in some cases they'll have a barcode for computerized scanning purposes, and date of birth. Someone in the admitting department or the admitting nurse applies the bracelet. For the client's safety, they must wear the ID bracelet their entire stay. Along with asking a client their name and date of birth, we must look at that ID band, their ID bracelet, every single time we go in to administer meds or administer a treatment, anything. The single most important method for IDing the client. The ID bracelet, if it's missing or it's been removed, we must make sure that it is replaced ASAP. And clients do remove those ID bands. Once personnel have collected preliminary data, they notify the nursing unit and escort the client to the site where he or she will receive care, period. This is showing a good example on page 169, figure 11.2. The nurse is applying the ID bracelet. They still use addressographs in some facilities. They're showing a figure 11.3 addressograph. You do not have to know that for this exam. Nursing admission activities, preparing the room. I do want you to know that that room should be prepared before the client arrives. It's stocked with the basic equipment, and it's just showing the soap, toothbrush, skin lotion, toothpaste, razors. We're not going to give razors now. Paper tissue, all of that, Enesis basin, a water pitcher, all of those basics. Just know that we want that room stocked before the client arrives. And I look at it this way. When we're going on vacation and we've saved our money and we've paid to get a motel room or a condo, whatever the case may be, when we enter that place, we don't want it to be in disarray. We want everything to be there as it's stated in the contract. So that's how we look at the client's room. Basic room supplies, box 11.1, I mentioned these. This is FYI, but a wash basin, a soap dish, emesis basin, a water carafe, that's a water pitcher, and a bedpan or urinal. Welcoming the client, this is very important. You need to highlight this paragraph. One of the most important steps in admission is to make the client feel welcome. On arrival, the admitting nurse greets the client warmly with a smile and handshake. We wear our name tag. It must be up at, like when the client's looking at us, right here. It can't be hanging on our waist. That is incorrect. It must be where they can see it easily. We introduce ourselves, introduce other personnel in the area. Being treated courteously helps the client to start to relax. A client who feels unexpected or unwanted is likely to have a poor and lasting negative first impression of that unit and the people. Welcoming the client, when we do all this and make them feel welcome, we will start building that therapeutic nurse-client relationship, which is based on what? Trust. Now in the real world, let me tell you the real world. When you walk in second shift and you're told you have 3 admissions, that paperwork is compared to a mountain of paperwork, and you just clocked in and you still have to give all the meds on the hall, you do the treatments, perform treatments. Is it that client's fault that's being admitted that you have all this work to do? No. We chose to be a nurse, and that is just part of our world. So even though we are aggravated, we do not let the client see this. Orienting the client, this is very important. You need to know we're going to help the person become familiar with their new environment so they can feel comfortable and adapt more readily. And this is FYI, but we're going to show them where the nurse's station is, where the bathroom is, the shower, where to store their clothing and personal items, how to call for nursing assistance from the bed and bathroom, how to use the call light, how to adjust the hospital bed, how to regulate the room lights, and just going on 170. What's something else we want to know? We want to know how to use the telephone and how to work the remote for the TV. Just common sense. You do need to highlight this on 170. Some hospitals do provide booklets with information about the agency, like the gift shop hours, newspaper deliveries, location of the chapel, or name of the chaplain. Even though they get these booklets, that does not replace our individual explanation to the client. Safeguarding valuables and clothing. This is all highlighted. Nurses give certain items such as prescriptions and non-prescription meds, valuable jewelry, and large sums of money to family members to take home. If this is not possible, what do? We must carefully observe the agency policies. Some institutions provide clients who are not expected to stay longer than 24 hours a locker to store their personal effects. The nurse may be able to place the client's valuables in the hospital safe temporarily. And remember, if they have credit cards, debit cards, all of these need to be safeguarded. From nurses give certain items to temporarily is SATA. You need to know it's best to be as descriptive as possible. For example, and this is important for you to know, rather than indicating the nurse placed a ring in a safe, it's better to describe the type of metal and the stones in the ring. You need to know losing a client's personal items can have serious legal implications for both the nurse and the healthcare agency. The client may sue, yes. They may sue claiming the belongings were lost or stolen because of careless handling of their belongings. So it is best to have a second nurse, supervisor, or security person's signature on the envelope containing the secured valuables. Always. So we sign it, another nurse signs it, supervisor or security person, somebody else that works in that facility must sign that as well. And also it tells you the nurse and the client sign. We want the client to sign it as well. You need to highlight that. So then we give one copy to the client and another copy is on the chart. When adding items or returning them to the client, we're going to revise this list and the client signs again the new inventory. You need to know this, client that comes with their own equipment, for example, wheelchair, things like that, walker, must have a large, easily read label. Labeling prevents confusing their personal equipment with those that belong to the facility. Most agencies do have places in the client's room for storing street clothing, like clothing we wear, street clothing. Yes, they will have their own closet, little closet. Now look at this, because clients occasionally remove eyeglasses and dentures from time to time, these items can be lost or broken. Generally, the healthcare agency is responsible for placing these items if negligence of the staff causes this damage. Now see, we wouldn't tell the family to take their dentures and eyeglasses home with them. They need their glasses to read, they need their dentures to eat. Helping the client undress. We will help them undress, like for a physical exam. We need to provide privacy. Have the client sit on the edge of the bed, which already has been lowered. The bed's been lowered. Help the client lie down if they feel weak. Release fasteners such as zippers, buttons, and remove the item of clothing in whatever way is most comfortable for the client and least disturbing. For example, the nurse folds or gathers a garment and works it up and over the body. He or she has the client lift his or her hips to slide clothes up or down. Also, we're going to cover that client with a bath blanket after removing the outer clothing, or put a hospital gown on the client, explaining that hospital gowns fasten in the back. We're not going to remove all their clothing and leave them lying there naked. Would you want to be done that way? No. We're going to keep them covered at all times. Compiling, let me look at this, figure 11.5 on the same page, inventory of a client's personal belongings. Let me give an example on this. When someone is admitted to the nursing home, the CNAs, they have to count the amount of dresses someone has, underwear, bras, shoes, coats, panties, bras, belts, anything. And they have to be counted and placed on this inventory sheet. So compiling the nurse database, you need to know this for exam. On admission, the nurse begins assessing the client. Remember, just general assessment, remember chapter 13, and collecting information for the database. Although who is responsible? Say it again and again and again. Although the RN is responsible for the admission assessment, he or she may delegate some aspects to the LPN, student nurse, or other ancillary staff. Physical assessment skills, which include taking vital signs. And also remember there's 5 vital signs. The initial physical assessment must be done by the RN. Gero, this is FYI, but to mention this again, detecting cues of elder abuse, neglect, exploration, we have to follow up with that if we suspect abuse. At least 10% of older adults are victims of elder abuse, which often occur from people that they trust the most, children, spouses, caregivers. So we need to always be cognizant of that. And that concludes Lecture A.